Hey Jen, so I promised I was going to do this for you. Hopefully this can relieve some of the tension in your back, and I'm probably going to have a couple of dogs come in because as soon as they hear me talk, they want to be wherever I am. So anyway, the first thing that you're going to have to kind of explore is what the pelvis is doing. And what I have found is that especially in triathletes, we have a little bit of a forward tilt in our pelvis, and so what'll happen is that'll cause a little bit of tension in your back anyway. So when you strengthen the core, you're kind of teaching the pelvis to kind of stabilize, and so I'm going to show you some of those as well, and also some stretches that we'll be able to do right after you ride, right after you run or such. So if I can get my one dog out of the way, you're also going to need just a little bit of a blanket, so just have that off to the side. But the first thing that you'll do is you'll lie down on your back, and so this is very, very subtle, so I'll try to make sure I get some inserts. So you lie down on your back with your knees bent, your heels on the floor, and this should be pretty comfortable. And you don't even need a yoga mat if your floor is quite padded. So what you'll do is lots of times when we do bridge pose, we don't do it mindfully without really exploring what's going on in the pelvis. So lots of times what we'll do is we'll kind of thrust the hips up in the air without really knowing what the pelvis is doing. So what you'll do is you kind of rock the pelvis back and forth. And so at one point in time, you'll feel a little bit of an arch. So this is when the top of the pelvis is kind of moving forward, and then you'll roll and then move it back. So this is when you see people say, okay, tailbone tucked. This is kind of what happens is your tailbone is tucking. So you think about if your lower back is pressing against the mat, you'll probably feel a little bit of a core activation going on here. So lots of times we'll press on with the heels, and you'll feel a little bit more core activation going on, but it's very, very subtle. And so again, so now the pelvis is kind of doing a little bit of a backward tilt. So you kind of move back and forth. And so this is what you sometimes will see in a cat and cow pose, which you do in all fours. And so you kind of feel a little bit of that rocking of the pelvis forward and then rocking back. So this is going to be important in a few minutes because what the pelvis is doing forward and what's back, it's going to be really personal to you because I really don't know exactly where the bulging is going on. So you kind of have to adapt it to where you feel the most stretch. So for here, what you'll want to do is now see if you can find a point in your spine where I personally like it when my lower back is actually flat on the mat and my core is engaged. But you find wherever you need to where you can feel the most stretch. And then place your hands on your thighs and then try to push your thighs away. So you'll feel your lower back kind of arch a little bit, and that's fine just as long as you're not purposely arching it a lot. And the more you press, you're going to feel a little bit of core activation, but you should also feel a really light tugging. And you just kind of press a little bit on your thighs, and it should reduce some of the compression. And you just kind of breathe through it. So it's rather than jamming your thighs away from your hips, you're just kind of doing a subtle tugging. All right, now my dog is whining. As she always does. Here she comes. Hi, baby. All right, so you should feel a little bit of release right there. And that way you're getting a nice little back stretch without really putting much torque on the back. So now let's roll over, and I'm going to move my microphone, my simulated microphone, into my back pocket. So now let's kind of move into planks. And so lots of times what we will do is, we kind of jam into our planks, and a lot of people will kind of lower their belly to the floor a little bit. And you almost, in a forearm plank, it's better to err on the side of your hips actually rising a little bit higher than your shoulders. But this is actually very, very strong core activation. But what I like to do is I like to kind of go through this in steps. And so what I'll do is I will come on my hands and knees and make sure that your right hip is aligned with your right knee, and really plant your hands into the mat, and then extend your left foot behind you and really press into the big toe of your left foot, and then press away from the mat with your hands, really thinking about pressing a little bit more with your index and thumb knuckles. So it's a little bit of an internal rotation of the wrist there, but you're also not jamming in, you're not doing an internal rotation with your shoulders. So you're just kind of pressing away, and by pressing the left toe mound into the mat, you're also pressing the left heel away, and you should feel a little bit of a stretch in the top left hip, but you're also feeling some core activation just above. And then if you feel a little strong here, now let's see if you can press into the mat a little bit more, and then raise your right knee an inch off the mat, and then raise your foot, and then come down, and then release. And I always shake my hips back and forth. It just kind of helps, just kind of lubricate all the stuff that's been activated. So then we try the right side. So depending upon where the herniation or the bulging is going on, you might feel a little bit more tension on the one side than the other. So again, you'll press in with your hands, press in to the floor with your right foot, and then breathe there and start feeling the activation, reaching the right heel back. So you'll feel a nice stretch here. And you should also feel the core strengthening. And then slowly raise the left knee a little bit off the mat, and then the right foot a little bit off the mat. And then release. And then take a breath. Okay, so this next part is is very, very subtle. Hold on. Is really, really subtle. So lots of times when we do Cobra used to really hurt me when I hurt my back. And that's because I was doing most of the backbend in the lower back where I was weakest. But really Cobra and backbends should be more of, you want to think about really arching the all of the back, and then certain parts of your back are going to be a little bit more, have a more of a range of motion. But you really want to think about trying to just get a little bit of arch in all parts of your back, and not really focusing on one particular place that might be sore. So what I like to do is, so we think about in a back bend, what helps me the most is thinking about the backward tilt of the pelvis. Now, of course, you're not going to have it completely backwards, but it's almost going to be kind of neutral. So what's going on right here is I'm actually very, very subtly pressing my thighs against the mat and then also lifting my belly button. So it's very, very subtle. I mean, we're talking like, and of course, you know, I have a little excess in my belly button. So of course, the belly button is barely coming off my mat, but it's the activation. So you think of what we were doing on our backs just a little earlier. So you think about the arch, so the forward tilt of the pelvis, and now the backward tilt of the pelvis. And you should feel a little bit of core activation there if you just kind of think backward tilt of the pelvis. So this might help a little bit, and then you might feel you can kind of ease your thighs away from you a little bit more as your body gets warmer. And then just think backward tilt of the pelvis, your core is engaged. Now very, very slowly you can keep that. And then you have like a modified plank here. And so what you really want to do is have this all straight rather than sinking deep, because that might actually hurt right about now. So think about this and everything straight. And now what you're doing is you're really using your core to try to keep your spine stable. So I like doing this and really think about the backward tilt of the pelvis here. Your core is stable. And that's going to help you in some of your running. And then one thing that I have just found, and this might be personal to you, you might hate it might hurt more, but it's just something that I have just noticed over the years that gives me a lot of release and a lot of relief of the compression. So you can do this standing, but I'll just show it to you sitting. So you'll stay on all fours, and then you'll just kind of rotate your left hip out and up. So try to think about, this is a little subtle here, so try to think about your left hip kind of opening up here. Of course, sometimes I get a little cramp on my right hip. And of course, your right foot might just kind of jut out a little bit, and that's fine. And think about planting the left toes down and then moving into a little bit of a back bend here. So you play around a little bit with the pelvic tilt and see what might actually provide a little bit of release here. So I'll explore a little bit of pelvic tilt. And then I'll raise my arm overhead and towards the front of your mat. And now you'll feel a full side stretch from the outside of your left pinky toe to your left pinky. And now what I'll try to do is I'll do a little bit of, so I'll try to do a little bit of a back bend here, just slight, but really think about reaching and getting a lot of stretch. And then I'll come back down. But I will do Halfmoon pose, which is the standing version of this. And I can actually feel the compression just coming right out when I do this. So again, so you'll be on all fours and then just kind of like you're doing the side. So side plank is like this, but really think about what your back is doing in this posture. So think about just kind of leveling your hips here, pressing in with your right foot. You'll feel the outside of your right foot coming against the mat. Really opening the right hip up. And then moving the arm overhead and just kind of breathing into this stretch. And I feel this a lot on one side versus the other. Over the years, my lower back on the one side was much more tense. And because I've done so much work and I had surgery on the one side, I found that the right side of my lower back is now kind of feeling a little tense as well. But it's also because I favor my left leg, so I'm still getting a lot of imbalance. Now we'll come down. And now you're going to get your blanket, and I'm going to let my dog out so she will stop. So we've done a couple of back bends, and so they're very, very subtle back bends. You'll want to, eventually when you start feeling less pain, you can start doing more hip openers and stuff. And when I say hip openers, some of it is this, opening this, because our IT bands are really, really, really tight. And that also can cause a lot of lower back pain. But also the internal thighs, if they are weak, which it's the case with me, that's going to cause some knee pain, as it is with me right now. But the key is you want to make sure that the back is stable first before you start in on stretching the hips to the extreme, because sometimes what will happen is you start stretching the hips and then your pelvis comes out of alignment and stuff. At least that's what's happened with me. But ultimately, the back bends, the way that I've given you, will ultimately stretch the psoas. But again, you want to avoid just those the Dhanurasanas and Urdhva Dhanurasanas right now, while you're still just working on just reducing the compression in your back. So you want to work on the weak spots and then move on to other things. But even still now, it's been 5 years or so since my back surgery, I still like to use a blanket for when I do any sort of forward bends. And in some cases, depending upon how I'm feeling, I will bend my knees a lot. And but anyway, what this does in a forward bend, especially if you've got back issues, a forward bend, you'll actually think about a forward tilt of the pelvis for me. So you think about, like in the back bend, you want to think a little bit of a more backward tilt of the pelvis. The forward bend, you'll do a more forward tilt of the pelvis. And it's going to engage your core as you come forward. Because lots of times what happens, especially when you see people who do Baddha Konasana, you see them all they just do this. And that's fine for yin, because you're not really going to 100% anyway. But it ultimately, for me in yin, I will feel my lower back just screaming after a while. So that's not worth it, right? So when I obviously you'll need to stretch your hamstrings, so that's also going to be part of your lower back. And lots of times what happens is we just kind of flop our leg over, something, and then just go into our hamstring stretch. But then we fail to figure out what our back is doing at the time. And so lots of times what I will do is I will ease into the forward bend. And so I'll just kind of do it a little bit more this way. And here comes the other dog. So what I'll do is, in order to just kind of feel my back through this whole stretch, I'll actually lean into the bent leg first, okay? And so you'll feel a little bit of a twist here. And if that feels okay, then you just slowly roll. So you want to think less of a backward tilt and try to think more of a forward tilt. So think about trying to get your belly button towards your ankle. And this might be fine right here. And if you don't feel a lot of ickiness in your lower back, then this is probably going to help stretch your spine. But what I also like to do is eventually you can touch the opposite foot, the outstretched foot. And then you'll feel some of the twist, and you'll feel some of the lateral stretch on the right side. And then think about, if this is your left outstretched leg, you think about bringing the hip in a little bit. And then also think about the thigh spinning in. And if you reach the outside of your foot, you might feel a little bit of an IT band stretch. And then sometimes your right hip might want to kind of jut up. Think about trying to stick it onto the mat. So again, this stuff is really, really subtle. So the same way you came in, you'll come out. And then come on up. So again, just that little inch or so from the blanket is going to help your pelvis tilt a little bit forward so you're not jutting too much into your back. So I'm going to start over on the one side and just allow the back to just kind of ease into the posture. So you want to roll the pelvis a little bit forward. And when it feels good, you will move on over. Move on to the side. So again, think it's better to be a little bit more upright and keep your pelvis a little bit forward than jamming too much tension in the lower back. And you move on over. So again, a little bit of an internal rotation of the outstretched leg. I try to reach for the outside of my foot. You can use a strap, but you don't even have to reach at all. Sometimes just the idea of just turning a little bit and just getting a feel. So it shouldn't be just that really electric stretch. That's probably going to hurt a little bit more. It's just a very subtle, easy stretch. Just to kind of remind your body. She's smelling the camera. And come on out. And then come on up. So then finally, I'm going to do some of this stuff actually, yeah, I could probably do it a little standing. It might be a little difficult for me right now. So I'm going to pause this right now. I'm going to put the camera up a little bit higher if I can. So these are typically some stretches that I do right after a bike ride or a run or something, just to at least kind of get some of the tension out that I've just created. Okay, so typically what I'll do is I will do a modified version of a forward bend. And so forward bends for me used to always absolutely kill. Especially when I used to do plow pose. I used to throw my legs over my head in a recline pose, and that actually really, really hurt a lot. But you can even do this next to a chair. This is my kitchen, my dining room table. But what I like to do is you can put your hands even against a wall. But what you'll do is you want to have your hand outstretched. And then what you'll do is you want to play around with that pelvic tilt. And feel the parts that are tense. So you'll also want to internally rotate your thighs. That creates a lot of more space in your lower back. And so rather than the full cat and cow that sometimes you'll do, just make sure you're just confining it to the lower back and just feeling, what they say, the tailbone tucked, and then a little bit of a arch. So what I will do is I will tuck my tail a little bit, so you'll feel again the little bit of a backward tilt of the pelvis, and that helps with a little bit of compression, and it also stretches the back muscles. And sometimes what I'll do is I'll kind of wiggle my hips as I'm doing this, so I'm feeling a lot of muscles just kind of getting a little bit of a tug. And so even here, you can even make this into a core movement by putting your hands on your thighs, bending your knees, and doing the same. So just a little bit of a cat and cow here. And then sometimes when I get my backward tilt, I'll remove my hands, and you'll feel a little bit of core activation. Okay, for this last one, you'll just have to see the top of my head at first. But, so I learned this from a yoga instructor in Hawaii. Of course, I didn't go to Hawaii, but she teaches there. How about that? So typically we have, it's called pyramid pose, intense side stretch, whatever. And you can use a block if that, if you have a block nearby. I have one of these yoga wheels, which is kind of nice because then you can kind of modify as you need to. If you ever want to borrow this, it's really, really good for the back as well. But here, this is really good for stretching the hamstrings. But you'll also want to think, because you're in a forward bend, you also want to think a little bit of a neutral spine. So you think about drawing the right hip back. So your core should be active. Your feet should be active. So, think about plugging your right big toe into the mat. And then even kind of squeezing the quads. The right hip moves back. The left heel is planted. And then what I like to do from here is just very, very subtly move my hands to the outside. And then again, think about internally rotating your right leg. Just slight. It's not like you're totally twisting, so your knee twists out of a joint. It's just a little bit, so you feel a little bit of a IT band stretch. And then switch. So your feet are only about 2 or 3 feet apart. It doesn't have to be a lot. Really depends upon what feels good for you. So I like to have a little bit more of a neutral spine here. Plug in your left big toe mound, toe knuckle. Think about a little bit of an internal rotation of the left hip, but it's also pressing back. Slight bend of the left knee. This is my bad knee. And your hips are going to be somewhat, I always hate saying level, but you just want to think about the left hip moving back and the right hip kind of moving forward. But these are just guidances. You want to think always mindfully about what your back is doing and what is creating ease and stretch in the back rather than tension or panic. Sometimes I did that. And then you move your hands a little bit to the left. Again, I feel a little bit of an IT stretch here. And then release, come on down. So ultimately, if you ever go to a yoga class, you'll want to avoid like sitting. Anytime that they ask you to sit, like, you sit, always make sure you have a block or a blanket nearby, because what that does is it causes you to have a little bit more of the forward tilt of the pelvis, and so you're not just crunching into the lower back. Because again, what we tend to do is we just kind of do one of these numbers, and it really, really hurts. I also find that any sort of core movement where you're like this is just a big no-no. Anytime that you're on your back and doing some core things on your back, sit on your thumbs. So basically just kind of put your thumbs, during just below your sacrum, and that helps a little bit. But again, you'll just want to avoid anything that does this. It's just going to hurt like crazy. All right, so hopefully that helps you a little bit. So hope to see you soon. Bye.